All right, you should be able to share your slides now.
Sorry, I couldn't find my unmute button. Hi, everyone. So today I'm going to talk about maternal mental health. Are you guys seeing my slides?
Yep.
Okay, perfect. Mm. And so May is Maternal Mental Health Month, and so I like to cover this topic whenever I can, wherever I can. So I know that you guys had a little bit of a similar topic not too long ago, but this is a little bit of a different perspective, and so just looking at it a little bit differently. 21.9% of mothers report less than optimal mental health, and half of women diagnosed with perinatal depression did not get the treatment they need. So if we think about that, that's a huge percentage, right? And not getting the the treatment that's needed. And so for those of you who are parents, you understand the stress of parents or have been around parents or been around kids. You understand the stress and complications that can place on you. And so thinking of all of the stress that is endured in that time and to think that, half of those individuals who are struggling with that don't even receive the help they need, right? So I'm going to play this video and I'm going to stop sharing after I play the video for us to kind of process and talk about it. So pay attention. Let me know your thoughts after.
Well, my guess is everyone here is either a mom, has a mom, or knows a mom. Well, this story is for all of us. In June of 2018, my husband and I welcomed a third child, another boy, to join his two older brothers, ages 7 and 4. We were all so in love with him. I couldn't wait to spend the summer bonding and enjoying the beautiful outdoors with my family of 5. But instead, I spent most of my summer in a dark bedroom, suffering from a severe and debilitating case of postpartum depression, also known as PPD. By mid-July, on one of the worst nights when I couldn't sleep, my bedroom fan began to chant to me, "Singe their clothes, singe their clothes," beckoning me to light my house on fire and burn my children. I had 3 kids to raise and a nonprofit organization to run, and yet here I was, hearing voices in my head telling me to hurt my family. I'm here today to tell my PPD story because my hope is it will help destigmatize and normalize this very common condition in new mothers, your friends, your wives, your sisters, even yourselves. You will need these tools to identify postpartum depression because she or you are going to want to hide the scary symptoms that come with it. PPD is a perinatal mood disorder caused by physical changes in women. Hormones drastically shift and drop after we have babies, causing emotional repercussions that are made even more severe when we are sleep deprived. According to Postpartum Support International, PPD is the most common complication of childbirth, impacting approximately 15% of women. Yet it's incredibly rare to hear anyone talk about it. Postpartum psychosis is even more taboo. It's that lovely little illness that causes those delusions and paranoia that I suffered from, and it only occurs in every 1 out of every 1,000 births. In the most tragic and rare cases, those dark visions become actions, and the women can hurt or kill themselves or their children. I started feeling like something was off just a few days after giving birth. First, it became incredibly anxious and paranoid, unable to think straight. I canceled all of my plans with family and friends because making decisions about where to go and what to do just felt too heavy. I was also terrified of germs and convinced that my son was sick. I checked his temperature every hour for a fever, but he was normal. By week 2, I was completely exhausted, but I barely ever slept. When I would lay down to rest, my brain would turn on full blast, becoming a revolving wheel of negative thoughts and fear. It was right around this time when I started Googling things like postpartum depression and PPD and baby blues. It was easy to see that I had every symptom, but it was much harder to admit that fact out loud. One day I was sitting on the couch nursing our newborn when I suddenly felt warm and nauseated, like I was going to pass out. I called my OBGYN office and asked specifically about postpartum depression, but the nurse told me my symptoms sounded like dehydration. At an urgent care clinic later that morning, an EKG on my heart showed some irregularities in its beat, so the doctor sent us rushing to the ER next door. There, the technician hooked me up to an IV, ordered an MRI, and gave me a CT scan. But before any of these tests took place, a distracted cardiac specialist came into my room and barely glanced at me or my newborn baby before misdiagnosing me with a rare and deadly heart disease called Brugada syndrome. I spent that night in a dark hospital room holding my 11-day-old baby, trying to come to terms with the fact that I was going to die and leave behind my 3 young children. The next morning, I was relieved to learn that all those tests on my heart and my brain, they came back with normal results. So physically, I was healthy, but I still felt panicky and anxious. I asked the nurses and doctors if maybe these were panic attacks caused by postpartum depression. I had just given birth after all. But the on-call nurse practitioner who breezed in and then out of my room with my discharge papers told me I was simply dehydrated and needed more rest. So over the next few days, I focused on eating, drinking water, resting, giving myself the space and the time to recover from childbirth. I even visited my OBGYN office in person this time, asking more questions about PPD. But this time, I was told not to jump to any conclusions or to rush into taking medication, and instead to first try talking it out with a therapist. But unfortunately, my situation got much worse before I started any treatment. In 2.5 weeks postpartum, I had a severe panic attack that lasted over 24 hours. I actually began hallucinating. We were at the park and I actually envisioned my children being attacked violently by the Canadian geese that were grazing in the grass nearby. Then on our walk home, I had more visions, this time of my kids being run over by cars and killed. I was so shaken with anxiety that I was convinced I was having an actual heart attack. I told my husband, something isn't right. Perhaps I'm bleeding internally, or maybe I actually do have Brugada syndrome. On our way back to the ER, I nearly jumped out of our moving car when I had another hallucination, this time of our infant's car seat detaching and slamming against the side of the door. When we got there, the check-in clerk recognized me from the week prior, and she smiled at me sympathetically as she took my vitals. My heart beat normally this time, but I wasn't leaving without a diagnosis. The ER doctor came in, a different one than the week prior, and this time he spent just 5 extra minutes to actually listen to me talk about how I'd been feeling. He showed me compassion when he sat down on my hospital bed, squeezed my big toe gently, and told me I had postpartum depression. He said PPD is common, that it looks different in every woman, and that I would fully recover. He then prescribed 2 medications and told me to be patient because antidepressants can take up to 3 weeks to begin working. Now, up until this moment, I'd never suffered from serious, ongoing depression before, and I'd never taken medication for anxiety. I was a healthy, mostly put together, high-functioning human. I felt like I had reached a new low. Then over the next 2 months, I suffered deeply, feeling short-tempered and agitated one moment and then uncontrollably sad the next. I cried so hard for so long some days. I thought I would dry up completely. TPD made me hate myself, inside and out. I referred to myself daily as lovely little pet names like vegetable and psychopath and crazy person. I thought I was lazy and disgusting and a horrible mother. I blamed myself for PPD, thinking I must have done something to deserve this. And on that hot night in July, when my fan hissed those scary demands above me about singeing my children's clothing, my thoughts also carried me one step further. I actually envisioned walking to the drawer in the kitchen where we keep our matches. I didn't think I would actually burn or kill my kids. Just to be sure, I made my husband hold my hand that night while we both lay awake in the dark, just to keep me accountable. My youngest son is 1.5 now. We all survived this. Yay! But I am most definitely still a work in progress, guys. I still take a daily medication
Oh, sorry.
to cope with my anxiety. And like any human, I still have plenty of days when I feel worthless. But at my lowest point, I thought I would never function or work or be normal again. And yet here I am. Moms, PPT is not your fault. But your symptoms are real. Get treatment now. You will recover from this very common condition in new mothers. And when you do, I hope you will share your story with every mom you know. We all need to start talking about postpartum depression. Thank you very much.
All right, I'm going to stop sharing. And clearly, I can't read my messages while the video is going because I stopped that. So let's talk about this for a minute. What do you all think? I see Lauren put in the chat, the story is way more severe than typical PPD. Yeah, and so this story, and that's where I wanted to kind of gauge and see what everyone's thoughts are. But while this is a very powerful story, it borderline psychosis, right? Because she's having hallucinations. And so we see that borderline of psychosis. And the way she describes some of her she describes some of her going to the extreme, right, of the geese attacking her children, and these can be common thoughts, right, but not really seeing that happen. And so you can see where there's just a little bit of borderline with some psychosis. Yeah. But what are other thoughts?
It was interesting to see how the first doctor just glanced over it like it was nothing.
Mm-hmm. Yeah.
As a mom, I found like parts of it to be pretty relatable to, and I know for myself, like whenever I weaned my second child, that's whenever it sort of hit me more.
Mm-hmm.
Um, but yeah, I think that it is pretty relatable, and it feels like we're suffering in silence as mothers, and it is something that is so common.
Yeah, yeah, that's why I love when she says, I hope that moms will share their stories and share them often, right? Because oh, I'm not sure what's happening. That's really important, and screening, right? And so even talking about, the first doctor kind of n not really addressing it. We're not really screening it a lot of the time. Postpartum and even perinatal depression and psychosis is goes undetected a whole lot of the time. Because we're not screening and we're not asking those questions, and it's very scary. Yeah, Celia said I'm surprised to find out how common it is. Absolutely. What are some other thoughts? Any other thoughts? I just, I really love that video because she's so open and honest about what she was experiencing. And I think of some of the moms that I work with and how scared they are to share some of these thoughts. And we see how extreme some of them can be, but how important it is to talk about it. And like she said, we all made it. A year later, they made it. But that's hard, right? And it's hard as a mom, like she was talking about those thoughts and feelings, and feeling like you're lazy or you just can't snap out of it or can't get it together, right? Because, so I'm going to read you guys this definition. The World Health Organization defines as positive maternal mental health to be a state of well-being in which a mother realizes her own abilities, she can cope with the normal stresses of life, can work productively and fruitfully, and is able to make contributions to her community. Like, no pressure, right? No pressure on moms out there to be fruitful and productive and not have stress. Like, I mean, that's just not realistic. Yeah. Yeah. So the pressure being placed on moms is huge. Any other thoughts? Okay.
And the only other thing I was sort of like, she went to like an emergency room, right?
Hmm.
I mean, I think, to me, that's also kind of, the challenge of the stigma of mental health in general, like where you go kind of reflects the care you might receive, right? And so, I think one of the continuing challenges is, for mental health to sort of, and this is not just for postpartum depression, but we often see that emergency rooms aren't staffed to handle mental health emergencies or mental health crisis, and so their training reflects looking for those physical things, so much so she got like the wrong physical diagnosis. And I mean, I think there's this underlying sort of challenge regarding access too, is, for her it was an emergency, but it was not an emergency in the eyes of an emergency department, because it was mental health. And so I think kind of where you go and where you seek support, and opening up the conversation of stigma of where can you go and get actual mental health treatment. Because I mean, she presented twice to an environment that really probably wasn't equipped or trained to recognize it or provide that for her, in a larger sense. And so, I think the location of care matters, and lots of times, we see that because people don't know where else to go. So that part struck me too, because I would have liked to, although I think she got minimized a little in some other settings. It was a sort of profound that's ultimately what happened. And I think, to me, I always remind myself, my that person's emergency is their emergency. It's an emergency to them, kind of regardless sometimes about what we view, at least on the medical end, as an emergency, to just always be mindful of that. So that part stood out to me in the story too.
Yeah. Yeah, and you hit a couple different points in there. Just like that statistic we talked about at the beginning, the 21.9 that are diagnosed with postpartum depression and only half seeking treatment, right? You have this other half who really just, right, there's so much stigma around it and so much, I mean, with a definition like that from a World Health Organization of like you're supposed to be functioning well, like positive maternal mental health, right? And some of it you cannot control, your hormones, your body shifting, regulating, right? And so it can, and I think sometimes in the, as medical professionals, and then also in the mental health field, I think it's hard for us to sometimes think of like in those situations, like that's a crisis, that's an emergency. Like they're not really sure where else to go. But I think over the past 5 years, I have seen such an increase in screening and identifying and the OB offices and the midwives and the nurses really stepping up and stepping in as far as identifying postpartum depression and providing support around that. So I do think we are getting somewhere with it, but I still think, even in mental health, when I cover this topic, still a lot of people are like, I don't really think about screening for that because I don't often work with mothers, right? And so a lot of the times, it really does go undetected. Yeah, great discussion. Okay, so I'm going to share my screen again. So postpartum blues is really common, right? We have about 50 to 80% of all mothers who experience postpartum blues, and that's within the first 10 days. A lot of the times we see that happen around day 2, day 3, but really within that first 10 days, right? Because your body's really starting to have some of those shifts and those hormone shifts. We'll see some excessive lows, tearfulness, irritability, not being able to sleep. Um, and a lot of the times it doesn't start till about 3 days because you're on this adrenaline piece of just having a bit new baby, new family, right? And then once that kind of dies down, we see some of those postpartum blues show up. And then postpartum depression, we look for after that 2 weeks. And so after that 2 weeks, then comes the diagnosis of postpartum depression. And it's just a little prolonged moods, low mood, that irritability, still sleep issues. Sometimes you can see some difference in what you're eating. Just a lot of tiredness, being very tired, loss of interest, um, some foggy brain, right? Inability to really gain pleasure from what's going on. And then we also see some of those thoughts of hurting yourself, your baby, or your family. Um, and so postpartum depression can last up until so a lot of the research says that it'll last, up until a year after, but I see some that have lasted up until 2 years after. So we still see that at 2 years. And I think breastfeeding has an impact on that too. So a lot of the times we'll see the difference with that. Factors that can lead to poor maternal mental health, that intergenerational trauma. So we've talked about it here before, right? When parents start to think about becoming parents, right, and conceptualizing that, they start to think of the parenting they've had. And sometimes if they've not had great parenting, it can lead to some of that intergenerational trauma, some of their parenting experiences. Sometimes they repeat patterns that they don't really want to repeat, right? If you've had kids, you think to yourself, I remember that moment where I was like, yeah, I'm not doing that as a parent. But sometimes our patterns of interaction lead us to still doing those pieces. And so our emotional availability can decline and we can repeat some of those generational patterns. Genetically, so if we have, women who have had depression or have depression in their family, have a higher likelihood of having postpartum depression. Um, Hormones, so looking at their hormones, hormonal changes, women who have struggled with that, right? So they could have a higher likelihood. And environmental, so what their environment is like, how it's impacted them. We actually see some with the environmental piece. I was just doing some research last month on this, and I was like, came across the environmental piece, and I saw pollution in there, and I was like, pollution? But there's been a lot of research that has identified that the toxins within pollution have impacted poor maternal mental health, and I never heard that before, and I was like, wow. So I was pretty amazed by that. There's a high, along with stigma, we see a lot of discrimination with Black women, Hispanic, multicultural, and so that has a huge impact on maternal mental health. And that continues to increase. Socioeconomic, and so some of the financial factors, absolutely, and lack of support. Support is huge. That's a big factor. I work a lot with postpartum depression, and I will tell you that the mothers that I see that are very successful are the ones that have support. And so, support from family, support from partners. So, whoever's involved, I always try to get some support because it is just it's very isolating. And like you all have talked about, like you feel like you're alone in that, and you're fighting this silent battle, right? Now we know that maternal stress does impact babies' brains, and so that's why we want to increase positive maternal mental health, even perinatal, right? Toxic stress exposure can impact the baby's brain development in utero. It can completely rewire the brains. So exposure, a pregnant person being exposed to violence or abuse, or chronic toxic stress can completely rewire the baby's brain in utero. And so we have three different stress levels. We have toxic stress, tolerable stress, and positive stress. And so toxic stress is that constant exposure that it impacts the individual's cortisol levels, which absolutely impacts the baby's cortisol levels, because raised cortisol levels can cross the placenta. And so that's what impacts babies' brains in utero. And the same thing when we look at higher likelihood of maternal mental health, we look at the environment has some of those same impacts on baby's brain as well, is being exposed to that toxic stress postpartum. So toxic stress has a huge impact. Trauma, so we see some of that, like we talked about intergenerational trauma, and then epigenetics as well. So the stress that alters our genes that impact babies and their stress responses and ability to regulate their emotions, right? And so we see all of that with babies when linked to maternal mental health. And this all comes and has a huge impact on parenting and attachment. And so definitely impacts that parenting ability. We know that trauma is directly linked to attunement, and attunement is linked to attachment. And so we want to make sure that parents, especially pregnant parents, remain emotionally available. So mental health definitely impacts that attunement and mothering sensitivity. So that ability to build that sensitivity to cues and respond to those cues that absolutely feed into that, not only that attachment, but building the baby's brain. And so we know that has a huge impact. Insecure attachment impacts their ability to regulate their emotions. And we see later on psychosocial issues if they're chronically exposed to them. So how can we help? These are a lot of ways that we can help, just as providers or even people that kind of walk by, stay involved, talk about maternal mental health early and often, right? Not something we always talk about, not something that's at the forefront of our brain. We want to reduce that stigma, so talking about it early and often. Supporting maternal mental health with tips and resources. Both of these websites that I have on here, they have great tips, great resources you can go to. Um, NAMI has some great areas to look at. HRSA does too. And so they provide some really great handouts. Talk to mothers about ways and strategies to reduce stress. So if they're able to reduce stress within their life, right, they're able to manage some of their mental health a little bit better. If you think about yourself, right, when you get super stressed, like everything kind of becomes chaotic in your world. Well, sometimes reducing that stress can reduce some of those mental health symptoms. And so finding ways to reduce that stress. And it sounds easy, right? You can say to somebody like, yeah, you need to just reduce some of your stress. Like that's not good enough. We need to sit down and say, how are you going to reduce your stress? What is the stress you're facing that you can reduce, right? Because when somebody, when you have a mother that's struggling with mental health or postpartum depression, they're not able to see that clearly all of the time. And sometimes some things are heightened. And so when hormones change and shift, and it can cause us to overreact a little bit, right? I think of that all the time. And women's health is not always discussed. Like I'm in perimenopause, so every reaction I have, I'm always like, okay, am I overreacting? I need to just step back and think about it for a minute, right? Those hormones have such a huge impact on individuals. So just remembering that. Encouraging self-care. I do not have one session with a parent that I'm not talking about self-care and how they take care of themselves, because that is huge. It's the whole life mask thing, right? Like you need to put your life mask on first, your oxygen, before you put your child's on. So taking care of yourself is huge. That is probably, you can ask anybody I work with, that's probably my main focus with all of the parents that I work with, is I really force them to take some self-care because it's really important, and not to feel guilty about it. New moms, especially, that can be really difficult. Screening early and often, screening. So a lot of people will ask me a lot of the times, what do we use for screening? And so we use the Edinburgh, right? Like for postpartum, but even just for perinatal anxiety, depression, using the PHQ-9 or the GAD-7, those both can help identify early and often, start having that discussion, so that you can start kind of addressing some of those needs. And identifying support systems. Sometimes people need help identifying who is a support for them and who can help them. So going through that with them, I usually go through and do an eco map. So for those of you who don't know, an eco map is like who's in your system. So you sometimes will have like one circle with the individual and then all these other circles, like what is in your system? Because a lot of the times people will be like, I have nobody. I don't have any support. I don't have any. But here, come to realize they may have a coworker that they can talk to, or they may have somebody from church or within their community that they can talk to, or a cousin that is healthy for them. And so identifying that support system and how they can support them is really important. But providing resources, being open, talking about this, and really being supportive, along with, treatment. So, these are just helpful tips, but really encouraging providing some of that treat or them getting into treatment specifically for their postpartum depression, medication management. We got to balance that out sometimes. Sometimes it's completely off balance. And a lot of the literature supports that moms who have postpartum depression with more than one pregnancy, they're looking at that being more of a mood disorder like bipolar. And so, that medication looks a little bit differently. So even kind of exploring that and talking with individuals about what their options could be. Any thoughts? So Lauren said, inflammatory response from the particles of pollution cross blood-brain barriers trigger mood symptoms, depression, etc. That blows my mind. Like, I so want to go down a rabbit hole with that because found that, I was like, man, like it's huge, right? You don't think about that. Any other thoughts? Any questions? Quiet group today.
Literally just what I was thinking. It's like, wow, this group is unusually quiet.
Well, thank you all for having me. I hope this was helpful and provided some helpful resources.
Absolutely. Thank you for presenting to the group today.
Yeah, and I will send this to you, Kelly. I apologize.
Okay. Thank you. And I will put up the slides for everyone to be able to access on iEcho. If nobody has anything else they would like to discuss, I can let everyone have a little bit of their lunch time. Our next session is going to be June 4th, and that is going to be on review of the beta study in addressing pediatric aggression. And that will be Lauren Swiver that will be going over that presentation.